This segment, we're going to talk a little bit about health care in Virginia and frankly, in the nation as a whole. When I was in the General Assembly, one of the things we were dealing with then was the Affordable Care Act, Obamacare, and we were asked back then to expand Medicaid, to operate a state exchange, and in the discussions, and this was under Governor McDonnell, and he'd made several reach outs to then Secretary Kathleen Sebelius to try to see what we as a state would be required to do to comply. And at that time, all the rules and the plans weren't out there. And one thing she promised us was great flexibility in ideas that we as a state could bring forth to address the uninsured program or uninsured problem that we had here in Virginia. And unfortunately, at that time, we got that promise, but no direction, no answers. We really we just chose in. We cannot create a state exchange. We cannot expand Medicaid under the terms that we've been given now. And as we watch now places across the country, states where this has taken place, some are now thinking they've made a mistake by taking action on those two things. But one of the things I've always thought was really important that we already had in place that we could expand upon is our state's free clinics, community hospitals. Matter of fact, a lot of this money has gone from the Affordable Care Act towards investment into some of the community hospitals across the country. And as you talk to some folks on one side of the aisle, they'll be quick to point out that Virginia's throwing away money. In some cases, they're talking about up to $5 million a day that we're forfeiting that's going to the federal government. I had dinner with Secretary of Health and Human Services Hazel just a few weeks ago. One of the numbers he mentioned was over the next 10 years, we may potentially lose up to $25 billion. Could you imagine how many of these free clinics and primary care facilities that we could provide for $25 with a billion with a B dollars? It's astonishing. One of the prime examples I always refer to when I talk about the success of these clinics and community hospitals and things of that sort is right here in our backyard in York County, and that's the Lackey Clinic. And I have seen this facility grow and its services grow over the years, and it's something that's just incredible. A beautiful building, wonderful facilities, equipment, and people. And here to talk with us about what makes Lackey so successful and how it can serve as a model for other clinics across the state, across the country, is Carol Sale. She's the executive director of Lackey Clinic. And Carol, glad to have you on this morning.
Thank you so much, Mike. It's a pleasure to be here.
Well, I as you heard me mention, I've just been so impressed with Lackey and with Lackey Clinic, and back in I knew Dr. Shaw and Jim and Cooka Shaw were the founders of this, and we unfortunately lost Dr. Shaw recently, and so sad to see him go. But boy, did he leave a legacy.
He did indeed. He did indeed.
Well, the clinic itself, you walk in here, and it's just like walking into the finest doctor offices, primary care physician offices I've been to. The staff is professional and courteous. Place is clean. The equipment is new. What is it that has made Lackey so successful to go from this one-day-a-week clinic in a small room to the facility and the services you offer today?
Well, Mike, I really believe that it's the culture that Dr. Shaw and his wife Cooka established 20 years ago, almost 21 years ago now, when the clinic was first developed. Dr. Shaw came to faith, and he really saw the scripture verse that what you have done unto the least of me, brothers, you have done unto me. And he really felt committed that we needed to establish a place where people that did not have access to health care insurance could come and have a very special experience where they were treated with dignity and compassion and caring and respect, so that their sense of worth and self-value was important. And we wanted the place that they came to reflect that, to be a beautiful building with great amenities and equipment and cheerful staff. And so we're delighted that we've been able to continue the work that Dr. and Mrs. Shaw started so long ago.
Well, you heard heard me mention about as some of the alternatives to Medicaid expansion, if we could put more money into our free clinics, community hospitals, and I realize that does not take care of the entire problem, because this goes well beyond into whether it's mental health issues or significant care that can't be provided in a clinic type setting. But certainly for preventive maintenance, I'm going to my industrial roots here, of preventive care and some of the primary care, and even the relationship that you all have with the hospital, maybe even to serve somewhat as a triage. It's again, I've just been amazed at what all you can offer. We're going to talk in a minute about some of the new services that you're really expanding, but what have been some of the traditional services that a patient can expect that they could receive there, and how many patients are you serving out of this one facility?
Well, absolutely, Mike. The clinic is a reflection of what most of the safety net clinics are able to do across the country or across the state in varying degrees, but we provide medical care, we provide oral health care, we provide mental health care, and we provide prescription medications. So we manage currently about 1,600 patients that live in the Williamsburg, James City County, York County, Poquoson, and Upper Newport News area. Most of them fall within 200% of the federal poverty level. So on the low end, that might be a single individual who might earn around $21,000 a year. On the high end, for a family of four, it's about $48,000 a year. And so when you think about trying to manage housing and utilities and food and other things for about $48,000 for four people, that doesn't stretch very far. And so their ability to try to cover the cost of premiums and co-pays for insurance is very difficult for these patients. So we're thankful to be able to stand in the gap for them and to provide services that they desperately need.
Well, one of the things that you'll hear the hospitals talk about, and I had a guest on earlier talking about the certificate of public need, and the hospital argument for the COPN is it gives them an opportunity to make up for some of what they lose in having to treat so many patients that will walk into an emergency room with something that really doesn't require their emergency room facilities. You all certainly take a burden off of emergency rooms for the type of preventive medicine and common sicknesses that you can treat there. But you've got a relationship with the hospitals in the area, don't you?
We do, and we're very grateful for that. We have charity care agreements with all three of the health systems in our immediate area, the Riverside Health System, the Bon Secours Health System, and the Centera Health System, and they are wonderful partners in the care of these patients. When we have someone that needs diagnostic work, x-rays, ambulatory surgery, sometimes inpatient admissions, they welcome our patients in and take care of them, and they do not send those patients a bill because they know how impoverished these patients are. But at the same time, we're hoping to be good community partners to our health systems to be able to manage these chronic illnesses that are not emergent in nature. So we work very closely with our patients to help them understand that if it's off hours and they're not having a crisis situation, then they need to wait and come to the clinic. We have walk-in, work-in appointments every day that we can work patients in, and we make sure that they know that if they have a headache or a cold or their blood sugar's off or something else, this is where they need to come, because the emergency room is the most expensive form of health care that costs everybody when the patients go there. So we are able to help reduce those non-urgent emergency room visits by having the patients be managed here in the free clinic setting.
Well, I've been very grateful and expressed my gratitude to so many. As a legislator, I had the opportunity to meet some of the directors of these hospitals that you mentioned and their representatives, and they really do an awful lot for the community that I don't think they get the credit for. And I think it's a great relationship that Lackey has, that you can work with each other in the way that you do. One of the new maybe not new, but something that you're really expanding on right now, and I've walked into the building at one of the meetings that I happened to attend over there, and I got a tour and I saw rooms set aside, and these weren't regular medical care; these were dentistry chairs, and found out you've got dentists on staff, and you're really expanding into dental care. Tell me a little bit about that.
That's true. Dental care is one thing that's not covered at all under the Affordable Care Act or Medicaid, and so it's a huge need in the community. And right now we take care of patients that have no access to any health insurance at all. But we started probably in 2006 with literally a closet that we cleared out. We were able to throw a dental chair in there, and the dentist and the assistant sort of kept their elbows in tight, and they were able to do what they needed to do. But I tell people in 2013 we had a extreme makeover to the clinic where we added 6,000 square feet, and that allowed us to expand our medical room space and our oral health care space. And so we went from that tiny little dental closet to now 5 fully equipped dental operatories, which all have fully functional dental chairs. They have the back stations. They have portable digital x-ray. So it's really as if you were walking into any of your own dental offices. You would have the same services here at the clinic. And as a result of that, we have really grown. When we first opened that dental area, we had a backlog of over 250 patients that were waiting to get in to be seen. Some of them had been waiting over 12 months for just a cleaning, let alone trying to get in for an extraction or for a dental carie or something else that needed to be addressed. And so we have, over time, have managed to work our way down and pretty much eliminate that waiting list. Now it might be about 3 weeks if you need to wait to get in to see a hygienist, but we're taking care of well over 700 dental patients right now, and last year alone we had over 2,000 dental visits come through our dental area. So it's really growing, and we have lots of need for support in that area.
Talking about the growth in the dental services that you offer, though, and you and I were talking offline about some of the staffing needs that you have. Let the folks know what they can do, what type of skills you're looking for, and how they can volunteer.
Oh, thanks, Mike. We really are growing enormously, and we have some tremendous community dentists that are volunteering their time helping with us. We have one part-time staff dentist on staff. She works with us 20 hours a week, and we have 16 community dentists that are coming to volunteer their time and their expertise and services to take care of our patients, and we are just so blessed by that. But if you've been to a dental office, you'll know that it takes more than just the dentist to make that happen. Dental assistants that are helping get the patient set up and all the equipment ready to go, dental hygienists that are cleaning patients' teeth and getting them ready for the dentist to do an exam of them and then treat them, and that's exactly what we need here. We are desperate for help from dental hygienists and dental assistants that can help our volunteers and our staff dentists when they're here to be really productive and to be able to move between rooms and increase the number of people that we can see. When we just have one dental assistant and one dentist, it's a great pair, but they can see one patient at a time and then go and set up a new room and then next patient. But when we have 2 dental assistants, that dentist can really fly because they can go from one room to the next and then back to the next room and then back to the next and move back and forth between them while the different assistants are getting those rooms ready and those patients set up and ready to go. So if there are some dental assistants and dental hygienists out there that feel like they'd like to get back to the community, this is a great place to come and do that.
Well, it undoubtedly is. That is something I'd encourage. If you are a dental hygienist, a dental assistant, please contact Lackey Clinic. Let them know you'd like to come by and see the place, talk with them, see how you can help. One of the other experiences that I've had with Lackey, of course, it takes money to operate this facility, and I tell you, a little bit goes an awful long way. You're all so efficient with the finances that you do have. I was part of a business partnership group where you're looking to bring businesses in that would commit to make very modest to substantial investments into Lackey Clinic. One of the program I'm set up on is once a year. I know, matter of fact, mine's coming up in April with my company. We'll make a contribution that we committed to, and as a business owner, and all you business owners listening out there, I know you get calls, and you know how it is. You give money, and then all of a sudden you make the list, and you're constantly getting calls. Lackey doesn't do that. If you commit and say we're over 3 years, we'll give $500 or $5,000 or whatever it is. You don't hear from them until you get that invoice and that one time, and you don't have to constantly worry about it, and you know you're doing something good. Aside from that, well, including that program, but aside from that, how can the community, businesses and individuals, help support Lackey Clinic?
Well, thank you, Mike. I appreciate that. The clinic is not funded by federal dollars. I think a lot of people think that there's federal funding or a lot of state dollars coming in. We do get some resources from the state through the Virginia Association of Free and Charitable Clinics, but really the bulk of our funding comes from businesses in the community, from foundations that provide grants to us that we apply for, from some of the churches that recognize the services that were provided, and then the bulk of it really comes from individuals who see the value of the mission that we're trying to accomplish to provide care to patients that have no access to health care and to support us in that respect. It's wonderful when someone feels like they can make a monthly or an annual commitment that helps our budgeting drastically, but it's really individuals that are willing to dig into their pockets and help us. And actually, we have a fundraising event coming up very soon, which would kind of be fun for folks to contribute to. Ben & Jerry's in Yorktown, Virginia, is having Ben & Jerry's annual Free Cone Day. So on Tuesday, April 12th, you can run by the Ben & Jerry's there in Yorktown right on Water Street, and you can get a free ice cream cone. And when you're there, if you'd like to make a donation to the clinic, 100% of those donations will come to the Lackey Clinic here in Yorktown. So we're really excited. We're so grateful to Bob Duramo, who makes this possible for the clinic each year, and will provide the ice cream for folks and the opportunity for us to be there and cheerlead the clinic. So if you'd like a delicious ice cream cone for free on Tuesday, April 12th between noon and 8 p.m., you can go to the Ben & Jerry's on Water Street in Yorktown, make a donation to the clinic, and enjoy your favorite ice cream.
That's fantastic. Ben & Jerry's, thank you for that. That's Tuesday, April 12th. You buy an ice cream, you make a contribution. Who doesn't love ice cream? And where can they reach you? What's a website? What's a phone number? We got about 30 seconds.
Our website is Lackey Clinic, Lackey, lackeyclinic.org, and you can learn about us there, or you can call the office at 757-886-0608, and we'd be happy to invite you to come by on a tour and see the clinic and what we're doing here.
Well, thank you so much for everything you're doing, for calling in.
Thank you.
And we'll talk with you soon. This is Mike Watson filling in for John Fredericks Show